Hello guys, welcome back. Today we will discuss about a topic that is very important one which we are listening here and there in everyday day-to-day life, that is crisis and crisis intervention. In previous one video we had a discussion regarding the principles and techniques of crisis intervention. In this video we will discuss detailing what is crisis, how we can manage crisis, what are all the available strategies and principles are there to overcome the crisis, etc. So we will discuss about crisis, type of crisis, intervention, principles and techniques of crisis in this video. So what is crisis? Crisis is a time of difficulty, pain or danger. So it is a time of difficulty, pain or danger. Or crisis is an attack of distress, an attack of a problem, distress, difficulty. Or crisis is a stage where people will start to worry and become less confident. During the stage of crisis, automatically you're confident you will get loose. Crisis is a stage of instability. Or it is an unplanned situation which causes damages to the person or the organization where they are living or where we are living. That is the meaning of crisis. Now we will see some examples of crisis or what can create crisis. Among that, the first and important thing is illness, any severe illness. Next is family issues, natural calamities, terrorism, divorce, financial problems, emotional disturbances, death, accidents. So these are all some situations which can create crisis in our life or instability or difficulty or panic attack or distress in our. So now we will see what is crisis intervention. Crisis intervention is a short-term or immediate response or technique to reduce the emotional or behavioral distress which is arised from crisis. A successful crisis intervention need a proper history and background information about the patient, because proper history collection and background information will help the person who is giving crisis intervention or who is planning crisis intervention can plan and implement the crisis intervention techniques in the proper way. There are different steps and strategies are there for the permanent solution for crisis intervention or to get out from crisis. Crisis intervention is very important because the people, those who are affected with crisis or those who are the victims of crisis, will show suicidality or suicidal ideation, and they will produce or they will show harmful situation or harmful behavior to themselves as well as to others. So now we will see the continuation of crisis intervention. The crisis intervention will help to restore an individual's equilibrium and minimize the potential for long-term trauma or stress. It will help to restore the equilibrium of their life. So in the time of crisis, the person will get a disturbances in the harmony and equilibrium of their life or the balance of their life with the surrounding. This crisis intervention will help to restore the individual's equilibrium and minimize the potential long-term effect of the trauma or distress. And certified crisis intervention counselors conduct different types of intervention. So that is very important. Certified or licensed, experienced, practically experienced crisis intervention counselors are needed to provide proper crisis intervention. And always remember that crisis counseling is not a psychotherapy or any other therapy. It is not a psychotherapy or it is not any other therapy. It is not related to any other therapy. It is a short-term techniques which helps to overcome the problems which is arised from the crisis. So it provides short-term intervention to help the person to get assistance, stabilization, support. So that point always you just remember, crisis intervention or crisis counseling is not a psychotherapy or any other therapy, but it provides short-term intervention or immediate intervention to help the person to get assistance, stabilization and support, or it will help to restore an individual's harmony or equilibrium as well as minimize the potential long-term trauma or the distress. Now we will see the types of crisis. First thing is natural or environmental crisis like flood, drought, etc. Maturational crisis, puberty, physical changes, etc. developmental crisis, existential crisis, that is internal conflicts, thoughts, etc., situational crisis, technological crisis, confrontation crisis, malevolence, and organizational misdeeds. So these are all some of the types of crisis which can create disability, which can create distress, and which can create pain and disturbances in your life. So what is crisis in mental health team? While coming to the mental health aspect, what is crisis means it is a stage which can create either damage, danger, or the opportunity for a new change in life. Crisis can be quite some time. In mental health crisis, you will feel anxious, sadness, hopelessness, helplessness, worthlessness, and stress, and also panic attack like some anticipation of fear, anticipation of danger, and suicidal ideation also will arise. Now we will see some definitions for crisis. First is people are in the state of crisis when they face an obstacle to important life goals and obstacles that is for a time insurmountable by the use of customary methods of problem solving by Kaplan 1961. Next thing is an upset in equilibrium at the failure of one's traditional problem-solving approach which result in disorganization and hopelessness, sadness, confusion and panic by Lillibridge and Klukin. And crisis is a perception or experience of an event or situation as an intolerable difficulty that exceeds the person's current resources and coping mechanism by James and Gilliland in 2001. Now we will see the signs of crisis. The signs of crisis are decreased performance at school, lack of interest in work, abnormal sleep habits, improper personal hygiene, sudden changes in the mood, irritability, lack of interest in normal activities, weight loss or gain. Next thing is what to do when crisis occurs. First and the foremost thing is identify what type of crisis it is, either emotional or situational. Second thing is plan and prioritize time and focus on important things which we need or where we need care. Next thing is find from where we can get and support and utilize it to the maximum level. Talk to your doctor and explain everything and decide either short-term intervention or long-term intervention is needed, and they will refer us to the correct expert to get proper support. Next, always care for yourself. Look for the ways to live away from stress and practice good self-care habits, eat and sleep habits. Next thing is how you can help your friend to overcome the crisis. You are seeing a friend with crisis or your friend is in crisis means how you will help your friend. First and the foremost thing is be a good listener. Listen your friend, what the friend is saying, what the friend is trying to express. So be a good listener. Assist and support with their practical needs like household tasks, personal care tasks, etc. Provide professional support and emotional support. Take your friend to a psychiatrist or a mental health professional from where they can get help. So these are all the things you can do basically or the first step when you see your friend with problems or with crisis. Next, we will see what is crisis intervention assessment. Crisis intervention assessment is the first stage in crisis intervention. So crisis intervention assessment is the first stage in crisis intervention assessment. That is the first stage. And there are 3 stages we can see in assessment. First is triag assessment, second is crisis assessment, third is social and cultural assessment. So a detailed assessment is very important to provide proper crisis intervention or to plan the proper crisis intervention. So what is triag assessment? In triag assessment, the patient's condition and necessary treatment approaches are evaluated. Patient's condition and necessary treatment approaches are evaluated. In crisis assessment, general information regarding an individual's crisis experience is collected. And in last one, that is social and cultural assessment, we will measure an individual's level of stress, situation and the severity of crisis. So a detailed assessment is very important in crisis intervention. Next, we will see some models to do crisis intervention, like how to plan and how to implement crisis. So there are some models. Among that, first and one of the important model is 7-stage crisis intervention model. It is also known as ACT model, Assessment Crisis Intervention Trauma Treatment Model, ACT, Assessment Crisis Intervention Trauma Treatment Model, that is ACT model or 7-stage crisis intervention model. There are 7 stages are there in this model. First stage is plan and conduct a thorough biopsychosocial and imminent danger assessment. So I told you assessment is the first stage in crisis intervention. So the first step among the 7 stages of this crisis intervention model is plan and conduct a thorough assessment. Second is make a psychological contract and establish a collaborative relationship with the patient or the victim. Third thing is identify the major problems, including what made this crisis. Next is encourage exploration of feelings and emotions. Allow the patient to explore their feeling. Next is explore or identify new coping strategies or coping mechanisms. Next is implementation of action plan, and the last 7 one is plan for follow up and booster session. So these are all the 7 stages of 7-stage crisis intervention. Step by step you have to follow, then you will get the better result. Next is SAFER-AIR model or SAFER-AIR intervention model. SAFER-AIR model, which helps to returning the client or the victim or the individual back to functioning similar to before the state of crisis. It has 6 stages. First is stabilize, acknowledge, facilitate understanding, encourage adaptive coping, restore functioning, and refer. So these are all the 6 stages of SAFER-AIR intervention model. Here also we are trying to do step by step crisis management, stabilizing the patient, understanding the problem, then encouraging the adaptive coping mechanisms, restore functioning like making the patient to return to the normal level, making the patient to come to the equilibrium of their life, and last we are evaluating and referring the patient. So this is SAFER-AIR intervention model. Next is ATSM crisis intervention model. ATSM crisis intervention model means acute traumatic stress management model. It is another model to restore the equilibrium and mental stability of affected individual. It consists of 10 stages. Assess for danger, consider the mechanism of injury, evaluate the level of responsiveness, address the medical needs, observe and identify, connect with the individual, ground the individual, provide support, normalize the response, and prepare for the future. So it is a technique which helps the patient to come back to the normal life. It is a process or it is a crisis intervention technique which helps the victim to come back to the normal equilibrium or normal balance of the life by doing a step-by-step stages, assessing, considering, evaluating, addressing, observing, connecting with individuals, grounding, providing support, normalizing, and prepare for the future. So this is one of the good crisis intervention models to overcome the crisis. Next, who can give crisis intervention? Psychiatrists, counselors, psychologists, police officers, emergency medical staff, nurses, doctors, and communication persons. So the people who can talk, the people who are trained in this area can give crisis interventions, and among that these are all the people normally giving crisis intervention and planning crisis intervention for the people those who are affected with crisis. Now we will see some basic principles of crisis intervention. In the previous video also we had a discussion regarding the principles. Once again I'm repeating the same thing only. So first principle is stabilize the victim immediately. That is the first step. Stabilize the victim immediately. Do the intervention immediately. First thing first. Immediately you have to stabilize and you have to start the interventions. Next is try to understand what has happened. Next, focus only on problem and stay on what can make the victim better. Then encourage self-reliance to restore the equilibrium of life. So these are all the basic principles of crisis intervention. Now we will see the techniques or the strategies of crisis intervention. So first thing is first. So that is the first technique. Always identify the type of trauma they are experiencing. That means either it is an emergency crisis or gradually growing crisis. Next, be a good listener, and it helps to understand the state of mind and the need of the person. Then check the safety of the victim. That is very important. Are they in a safe stage? That is very important because those who are in crisis have the tendency of suicidality and self-harm. And check their physical needs, whether they are meeting, such as personal care, they are getting enough food, they are getting enough sleep, they are in a place where they are supported, etc., etc. Next thing is also need to check the safety. Means there are any chances of attack from any other side. That means physiological or psychological attack. So these are all the major techniques. First thing is first. Always identify what type of trauma. That is very important. Based on that you can plan your crisis intervention modalities. And next thing is check the safety of the victim. Safety in the sense not only danger, check whether they are getting enough food, whether they are getting enough sleep, whether they are getting a place to sleep, whether they are relaxed, whether they are not taking all the stress to their brain. So check the safe piece. Develop new coping skill. That is the another step in. And while developing new coping skill, it is very important to build resilience to create a healthier life as well as to overcome the obstacles. For that, we can provide physical and emotional support. Try to understand the patient and try to strengthen the relationship with the victim. Practice problem solving skills. Actively involve them in relaxation techniques and indulge them in victim support group, Alcoholic Anonymous group, etc. So support groups are very helpful for crisis intervention. Depend upon the situation of the client or the victim, we can approach the support group. So these are all the techniques and principles which we are using in crisis. So hope you understand, guys, what is crisis, the techniques of crisis, principles of crisis, strategies of crisis, and the crisis intervention models, etc. And I will also add the link of the video which we have discussed previously regarding the techniques and principles of crisis. Okay, so this is about crisis and remaining explanation about crisis. Hope you understand, guys. Thank you.